Hi guys, so what my case study is on is calcification in the thyroid. Um, this is not the most exciting, but here we go. So the equipment used was the GE Logic S7 Expert ultrasound machine right here. And then the probe was the GE C1 5D curved array probe. So the patient background and history, this patient was a 56-year-old Caucasian female. She had a previous scan of her thyroid done, and the radiologist deemed she had a non-toxic thyroid nodule. That's what she was here for. That's what the diagnosis was. So they were monitoring this previous thyroid nodule that they had known about. Um, the patient had a history of smoking. Um, I read somewhere that smoking could possibly affect your thyroid, so that's always important to find out if they smoke or not. And then patient had possible hypothyroidism. This is not a diagnosis or anything, but when I was scanning her thyroid was very enlarged and heterogeneous, so um, it led me to believe that she could possibly have hypothyroidism. Okay, so here is a picture of the calcification. This is in SAG. It's right here. And then you can see it's causing shadowing right here. And then in transverse, here it is. And then it's causing shadowing here. So it's not very big, but it's noticeable. I noticed it right away because I noticed the shadowing. So that's a good way to, if it's smaller, to look for shadowing because that was like a dead giveaway. So this is what hers looked like. And then here are some pictures of other modalities that can show thyroid calcifications. So you can see right here. And then here, I always like to include what it could also look like. So it can look like a little ring right here. And then right here, you can see, and you can see this is causing shadowing too. This has the shadowing. This one's a little bit bigger than what I saw in my patient, or around the same size. And then here's this one. So I just like to include what it could possibly look like as well, just so you have more of a background or idea in case you do encounter it while you're scanning. So the sonographer's report, what I wrote, on the right thyroid, there was a nodule measuring 3, 2.3, and 1 centimeter. That's the one that they knew about. So I just documented that. And then on the left, there was also a nodule 2.1, 1.0, and 0.9. They knew about that one as well. And the left thyroid, this was not on her previous scan. So I wrote left thyroid, there was a singular calcification measuring 0.9, 0.8, and then 0.5. That was not, I think I just said that, but it was not on her last previous exam. So I made sure to include that in mine. And the doctor, radiologist read it, and follow-up nodules had not grown in size, which is good. And single calcification will be continued to be monitored every year, like she comes for her thyroid already, along with the nodules to make sure it doesn't get bigger. She already comes once a year to get her thyroid scan, so we'll just keep an eye on that calcification. Just to make sure, just like the nodules, it doesn't get bigger or changes like shape or anything like that. So what happened after, the patient will come back each year to get a follow-up ultrasound to make sure nothing changes and or gets bigger. Okay, so what is a calcification in the thyroid? Thyroid calcifications are classified according to their diameter and location. So on ultrasound micro, let's see if I can do this. Micro appear as hyperechoic spots less than 1 millimeter in diameter and can be named as stromal calcification, bone formation, or I don't know how to say Zama bodies. I don't know. PBs. We're going to say PBs. Whereas calcifications larger than 1 millimeter are macro calcifications. So micro, they're less than 1. Macro, they're greater than 1 millimeter. When calcification is noted within a solitary thyroid nodule, the risk of malignancy is very high. So like my patient, she only had one, but since it was small, he didn't want to jump to her getting surgery right away. If it was greater than 1, very much greater than 1, I think he probably would have considered surgery. Since there was no calcifications on her right thyroid, it was just on her left thyroid. So that's why he didn't suggest surgery. The thyroid cartilage calcifies. So this is kind of what this statement here is, what causes calcifications in the thyroid. The thyroid cartilage calcifies and ossifies due to a normal process of mineralization, which usually begins after adolescence and will gradually increase with age, which with my patient, she was 56, so the mineralization definitely was going on. She's 56. Okay, and so I just included more images. I don't know what that one is, but here you can see it right here. And this one looks almost identical to my patient. Are these my lines? Hold on, let's see. Okay. So the top left right here, you can see that one looks like what I had with my patient. And you can see it right here. So I just look for the shadowing. Sometimes it probably won't have shadowing, but that's a good way to look for it.